Hello, everybody. Welcome to the first of our Ask the Exec session. Really looking forward to this. It's the first trial to see how it goes, and we'll obviously iterate it as we go along. But it's good to see lots of people on the call. For those of you who don't know me, I'm John Bruin, Chief Executive. You're wondering who on earth's talking. We're in the Tony Footitt room at Duncan Mill House today. I'm going to do a sort of, and then we're going to open up to answer as many questions as we can from people. First of all, though, just for my colleagues in the room to introduce themselves. So, Becky.
Becky Sutton, Director of Community Health Services.
I'm Julie Atfield, I'm Director of Local Mental Health Services.
Hello everyone, my name's Anne-Marie Newham. I'm the Executive Director of Nursing, AHPs and Quality here.
Great, thanks very much. Just a couple of sort of logistics of how we'll do it. We're recording the session so that it'll be available later for people to look at, and we'll also try and cover as many questions as get raised today. But if we don't, we will look out for those questions and make sure that we do get an answer to specifically to so that people can get responses. So where are we? I think the first thing to say with any of these conversations with our people is a big thank you to everybody for what you're doing. We do appreciate that it's really tough out there at the moment, and it's going to get tougher. The wave 2 has hit everybody really hard, particularly across the county, but also the East Midlands. And we know that staff are going to some extraordinary lengths to cover services, and we've had to really look closely at prioritising our ward work, our crisis team work, children into services into children, adolescent services, for example. And we are very grateful for people that are working in redeployed teams, and for making sure that we can be as good as we can for the people that need our services and need our services even more during these times. And at the same time, having to manage your own personal and family issues, the challenges that we're all hearing about over Christmas and what holiday season is going to be like. So big thanks is the most important thing to start off with. A couple of specific pieces that we discussed at some length this morning in the executive team meeting is staff testing. So this will be a really important sort of pivot point in our progress through the pandemic, is access to mass staff testing on a regular basis, so that we can identify people that are one of the principal causes of the outbreaks that we're having across the organisation. And we're about to launch something called lateral flow testing. The benefits of this is it's easy to use, it's a nasal swab, and you get the result within 20 minutes, and it's very accurate. And we're going to be asking staff to do this, clinically facing staff, twice a week, and there'll be a whole load of facts and advice about what to do in various circumstances if you're positive, if the test doesn't work, if you're negative. But it'll give us a really live picture of where the infection is across the organisation. We're expecting the first massive delivery tomorrow, with a view to getting it rolled out at the very start of next week. The trusts that have been piloting it have found it, and once you've got it running, that it's effective and a really good thing to have. So really pleased to be starting this very soon. The second big piece of work that there's a massive amount of input going into is the preparation for the COVID vaccines. You'll have all seen on the news the really impressive efficacy of 3 of the 6 or 7 contenders already. These are all awaiting approval from the Medicines Regulation Agency, and that's expected very soon. And the very first start date is in the first week of December. There's every region across the country is prepping for this in terms of the facilities, the estate, the people, the clinical inputs, the vaccinators, and all the governance around doing a mass vaccination programme. One of the challenges is that you'll have heard that the first couple have got quite significant logistics issues about having to be kept very cold. So all these sites are dependent on a very big freezer with a big plug to keep them at about -70. But the future ones, the Oxford vaccine, can be stored in normal fridges. There'll be a number of changes to the plans, and that will continue right up to day, I think. And so we need to be prepared to be agile and refresh our plans as we go. One of those current changes that has occurred this week is that the prioritisation list has changed. So that's led to the fact now that health and social care staff are top of the list. And we need to start to plan as an organisation how we enable our staff to get vaccinated as soon as possible. So obviously there's an awful lot of communication to do about how everybody can begin to access that. And that's the 2 big things I just wanted to update on. I'm probably going to leave it there, Alex, and happy to start to take questions. Thank you.
Please feel free to put your hands up or add any questions to the chat, but we have had some questions sent in. The first one is, I've seen information regarding becoming a governor. What does the governor do within the trust, and what are the expectations of the role? If you want to answer that.
Okay, yeah, that's great, and very topical too. There are vacancies for governors that we're currently out to recruit to. So please have a look on Connect and various other media to find out about that. Being a governor, and therefore on the Council of Governors, or COG as it's called, is an often misunderstood role. And actually the Council of Governors has a very important role. For example, they will contribute to appointing the chair, and they actually have a really important role in keeping the organisation. They hold the organisation to account through the non-executive directors. So it can often be perceived as, just a talk shop, but they do have some standing. They have a really important connection with the populations that they represent, and for foundation trusts that have an effective council can really services, the experience that patients, service users receive. So it's a really important role, and essentially there are 2 different parts to it. There's a section of staff governors, and there's a section of what are called public governors that either represent particular organisations, domains or geographies, and the staff governors obviously represent the services that they work in. And we're always really keen to encourage staff to get involved and put themselves forward, because it's great for career development. It gives people a real different insight into the context of their service in a broader role of the trust. And certainly the majority of people I speak to of our staff that have been governors have found it really rewarding. And the reason I might sound very knowledgeable about this is because I had to do some swatting up yesterday, because we did a chat pod with the chair and one of our staff governors, Palab, who will soon be available to watch, and he gives a really good insight into his experience of being staff governors for the last couple of years. So great question, thank you. Thanks.
And we've just got a couple of questions with regards to the vaccine, and I don't know if Anne-Maria, you want to add anything that with regards to what John said, but also being specifically asked about the rules with having a flu jab and the COVID vaccine.
Yeah, so I'm more than happy to take that. In response, there's a couple of things. You're required to have 7 days break in between having had the flu vaccine to having had the first COVID vaccine. And that's really, really important. So that's why we're encouraging all of you to have your flu vaccine as soon as you possibly can, or you're booked into your clinics. There's no getting away from it. I cannot see that all of our staff will have had their COVID vaccine before Christmas, because the logistics of getting it sorted and making sure that everybody has access to it are still being sorted through at this moment in time. So we're doing a big piece of work at the moment to work out how we're going to get all of our staff through to ensure that they can have access to the COVID vaccine. Now, things around that, in as much as where they need to be stored, and I'm sure most of you have heard this in the press or in the media about the fact that it needs to be stored at minus 70, which is what John was just alluded to. But there are a couple of different vaccines out on the market that we have purchased and that are being sent to us as an NHS, that there may be some differences about how they can be stored and where they're to be stored. So we're just working all that through at the moment. But what we can assure you is we've got a really good team, a really proactive team on it to make sure that we're all vaccinated as and when we can be.
Thank you. We've just had another question, which is just looking at, have any of the corporate staff been redeployed to support frontline services? So
I can take some of that.
Thank you.
Yeah, so we submitted on the 9th of November to HR all of the names of staff that are currently working within corporate services that could be redeployed. So we have already put together what that looks like. And then over the last two weeks, staff from corporate services have already started to move out into clinical services. For example, we've got 4 people from quality improvement team, 2 have gone to mental health and 2 have gone to community health. We've got a safety team, they've gone out into adult mental health. And we're also redeploying into other areas like the vaccination programme, like the flu campaign. So we have many staff from corporate services that are being redeployed into different areas. So it has already started and it will continue to go on as well.
thank you.
I didn't know if anybody else wanted to mention anything around that. Yeah.
No, that's
No,
good. I haven't got any other update on that.
Yeah.
Excellent, thank you. And probably for yourself, Julie, what have been the demands on mental health services during this lockdown in comparison to the previous lockdown?
Okay, well, it's quite variable and it varies by different services and different patient groups. So largely during wave 1, we saw a massive reduction in referrals, and variously that's been restored since wave 1. What we're finding now that we haven't seen the drop off again, which is good, but we still see the residual from actually the referrals not being fully restored to what they were pre-wave 1. And it does vary by different patient groups. There are some patient groups that are markedly different. So for people with intellectual disabilities, for example, we've seen a massive increase in referrals from wave 1 onwards. The graph goes like that. Where we are not seeing people coming forward in the rate that they used to, particularly relates to early intervention in psychosis, People are not seemingly accessing primary care or going into the emergency they used to for numbers. And that means we're not getting as many referrals through that route, particularly into adult mental health. What we are seeing though is a continued growth in crisis activity and a growing level of acuity in the people that are coming forward. So as well, we've had an increase in people accessing 136 suites. So it's a bit about not all the referral rates have been restored. Some are clearly continuing to grow. For example, children and young people's referrals are climbing and have done since May and are continuing to climb. So it's positive. We feel that we haven't seen the same drop off, but we are still recovering from the drop off that we had in wave one. And I think there's probably still that reluctance there in the public not to be accessing the places where they get referred to come into our services. So it's markedly different at the moment.
Thank you very much.
Can I just a couple of things to add about that? There's been a national, or there is a national spotlight on a couple of areas of our services that quite rightly have an awful lot of scrutiny as a result of the pandemic. And the first of those is intellectual disability, or learning disability as it's called from the national team, and suicide rates. And there's been some recent publications. There's been parliamentary select committees looking at it. The initial conclusion around suicide rates was that there hadn't been an identified increase in rate as a result of the pandemic. And that's not to say that, as ever, that every suicide is a personal and family tragedy. But there was some really good interrogation of the data to suggest that despite people's concerns, suicide rates haven't gone up. However, the news with regard to learning disability was less positive in terms of the fact that that group of vulnerable people had actually died at an increased rate compared to the general population. And again, that was with some really detailed scrutiny of the data through Bristol University and others. And again, quite rightly, as a result of that, our systems, not just the service that we provide in the trust, but more broadly within primary care, social care, and community care, where people with these vulnerabilities receive services, really make sure that we continue to provide the best service we can, because they are even more vulnerable in the pandemic season. Thanks, Alex.
Thank you. This is the last question that's been sent in. So if anybody wants to ask a question, please put it in the chat or put your hand up. But probably one for yourself, Becky. There's a lot on the news at the moment just regarding care homes. How are we supporting care homes within the trust?
Thank you for that question. So I think in a number of ways, I think some of the press media around care homes being affected with COVID and outbreaks is the same as we've seen in a lot of embedded sort of areas. As an organisation, we provide quite a lot of wraparound care in a number of care homes. So our community teams going in, managing a slightly higher level of patients for a period of time on that discharge to assess and reablement pathway. But also we've got a number of initiatives to support the care homes, again, providing education training and care into those care homes. I think it's true to say as a system, we've got a really good handle in collaboration with the CCGs on various care homes, outbreaks, and how we manage that bedded base across the system. I think it's really complex and really challenging, and I think it's a little bit, we have one home that may have to be closed because of they've got 2 or more residents or staff with COVID in the home, and we're finding that managing that bed base and knowing what's open and what's closed reasonably challenging. But I think What I would like to say is, as a system, I think we're all working really well to manage the best flow of patients, whether that be out of the acute, but probably more importantly, I absolutely acknowledge the hard work our community teams are doing to keep people at home and manage them as we do 365 days of the year. So personal thanks to all the teams. It is challenging and they're working really hard to try and keep people in the right place and patients.
So that's the final questions.
Can I mention something?
Yeah.
Is that all right?
We'll let you.
That's wonderful. Thank you, Dr. Bruin. So I wanted to mention two things. I just wanted to say how fantastic a response you've all made to the staff survey. And we're probably at the highest that we've ever been at 52.6%. And it was just to say, well done, whoop, whoop. But what I now need you to do is, can you now move your attention into the flu jab, please? So we are regionally at the very bottom of the patch, which is really unusual for us. It's not a position that we're normally in, but we are at the bottom. And I was interested in some of the closed Facebook page where we asked the question why staff weren't having the vaccine and the jab. And we had some really, really interesting responses. So I just wanted to say to you all is that it isn't a live vaccine. You do not get a live element of flu. And I know that some of you have said that you were poorly after having the flu jab previously, and it therefore has put you off. But can I just say to you that that shouldn't be the case? And I know that that's how you feel. But actually, my plea is that you are protecting all the staff that you work with, your loved ones, the patients, really importantly, because they can't necessarily go anywhere, and also carers and families. So it's just to say that this is a real plea from the Director of Nursing, that it's important to have your flu jab. It's not just for yourself, but it's for so much more. And it really, really supports the community and the health community as a whole. So that's my plea, to go out and have your jab. We're doing lots more drop-in clinics. We're trying to make it as accessible as it possibly can be for all of you. If there's any reason why you think we've not put something in place or it's just not doable, then let us know. Let us know what it is that's stopping you from having it. But like I said, this is my plea to you all. Thank you.
I'd echo that, Anne-Maria, and I should have mentioned it in my briefing. It's really important. I won't. But again, there is a massive amount of national scrutiny across all trusts, and there was a conversation I was listening to yesterday with the Chief Nursing Officer for England, who's saying it's a professional responsibility, and like I say, we're not used to being bottom of the pile, and I'm sure it's not going to be for long.
Mm-hmm. Yeah.
If there's questions, is there anything anybody else would?
But mine's not a question, but I am going to make a bit of a plea. This is another plea. I've got an audience now. I see all of you. Right.
She started, so she'll finish.
I'm going to start, so I'm not going to finish. I'm not going to finish. No. So this is a genuine thing. So the comms team and Suzanne's on the call today are going to support with putting a message out about how you wear your mask. Now I know on Facebook you've seen some really, really funny things, like you don't wear them like your underpants. However, in all seriousness, right, is that and I think if you're not used to wearing a mask and you've never been taught to wear a mask, then we've just assumed, we've sent them all out, lots of boxes, and just, use your mask. What I just want to say is that there is a very set thing that you have to do with your mask. You have to make sure, firstly, that you've got it on right. And what I mean by got it on right is that your metal needs to be at your top so that you can pinch your nose. And the reason for that is important is so that the folds are the correct way, so that you're not catching any germs and viruses into the folds. Secondly, do not touch the front of your mask. Please, please, please do not touch the front of your mask. You're allowed to touch the very top and the very bottom in order to put it on to make sure it's there. But do not touch the front. That is where all of the germs are. When you touch the front and then you go and touch the desk, or you touch the kettle, or you touch the door handle, or you touch the photocopier, that is how it's spreading. As chair of all the COVID outbreak meetings, this is my plea to all of you. Please be really careful. Also, you all have an individual responsibility to clean any items that you've been using. So do touch point cleaning with the Clinell wipes that are available. So make sure that you do that as much as possible. We're currently at 16 outbreaks across the trust, 16 outbreaks. We haven't had any outbreaks for some considerable days now. So I want to say a massive thank you for everything you're doing. You are all working so hard, but I want to help you to reduce the spread. And this is one of the things you can do around your mask. Thank you very much.
Thank you. Anyone else want to make any pleas? Have everyone got any questions? So, in which case,
Thank you.
finish.
Thank you very much. A recording of this will be uploaded onto Connect so that we'll be able to share it with colleagues, and it'll be the same time next week. Okay.
Thanks very much.
Thank you.
Take care, everybody. Thank you.
Thank you.
Bye.